So as I say, we know that virtually all patients with systemic sclerosis carry antibodies that can be measured using different techniques, some of them cheap and inexpensive, some of them more specialist. Each of these antibodies helps us to predict a particular disease course and is clearly trying to tell us something really important about the causes of the disease. And as I say, some of this work associating some of these antibodies with the presence of cancer is really tantalizing us as to where we might go in the future in terms of antibody work. Educating patients with systemic sclerosis about the antibody they carry can help them understand how their condition might develop in the future and hopefully allow them to rule out concerns about any particular disease-related complications that they may develop. Unfortunately, we have our work cut out because most rheumatology units can still only test for 3 of those 10 scleroderma-specific or associated autoantibodies. And this feeds into Dr. Lanyon's talk about the need to work together as hospitals in the UK to make sure that patients have equitable access to diagnostic tests. An important component of that is to make sure that a patient seen in Hospital A has similar levels of access to tests that are otherwise only done in Hospital B. And that's something that we're hoping to work towards. The big concern about hospitals having a limited repertoire of tests to diagnose scleroderma is a number of patients will go to those hospitals and be told they are ANA negative and reassured that they haven't got systemic sclerosis, which could lead to misdiagnosis, a delay in treatment and poorer prognosis.